You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is Dr. Jayne. Dr. Jayne, welcome to the program.
Good to be here.
Now, before we get into today's topic, tell us a little bit about your practice. I guess you're right in the heart of downtown.
Right in the heart of downtown Seattle. I've been there for about 13 years now, and I've been practicing for over 30 years now. We do a lot of cosmetic dentistry.
I mean, you're known for that. Also,
well,
that's where you made your name.
I've tried to build my name in cosmetic dentistry. We do a lot of that. I am a general dentist, and I've taken a lot of continuing education over the years in a variety of areas.
In fact, you told me when in the green room, you said, I probably go to more continuing ed than anybody,
Well, I get kidded about that by a number of my friends, but I do a lot of continuing education, and I find that's what, for me, really creates the joy in dentistry.
It seems so straightforward, though. I mean, it's like we're talking about dental implants today. Is there that much, that many subtle nuances that go into it?
It's, well, several issues about that. It's a growing field. It's becoming more popular. More dentists are beginning to do that. More patients are having it done. So it's an area that's expanding. And also, it's an area that's evolving. There's all kinds of research going on in implant
I've been to your office.
today.
Beautiful office, by the way.
Oh,
thank
you.
You have complete views.
Well, it's,
while you're in the chair, you're looking at everything.
It's we've got not panoramic views, but we've got fabulous views out in what's going on in downtown Seattle. It's my dream office.
Is it?
I was in another office for many years up on, not too far from here, up on First Hill. I always wanted a larger office. I wanted to have a more relaxed setting. I wanted to have something that was more comfortable for patients. So when I built this office, this is my dream office, and I love being here. It's been great.
Now, your background and training. You've been in and around implants for how many years now?
Well, I treated my first implant case back in the early 80s, not too long after they came out and were introduced in the United States. And I've been just sold on what implants can do. So I've been involved in implants for many years now. Originally, we were restoring the implants, and now we're doing both the restorations, and we're actually placing the implants.
So you do both. And so I'm clear on this, how it's normally done. You go to one person to do the surgery and the other person to put the tooth cap on top. You do both.
Yeah.
Is that right?
That's correct.
Okay.
Yeah, usually it's done by, there's a, one person puts in the implants and places the implants, and then that's referred to the other dentist to restore that. I found for me, since I've been placing my implants, doing the surgery
Placing meaning doing the surgery?
Doing the surgery.
Okay.
Has actually improved my prosthetics. When you're doing both, I found, at least in my hands, that I've the nuances of what you're trying to do to achieve the aesthetics, and that's a big part of what we do today, is to make implants look natural. When you're done with the case, when you've treated someone, you want them to have a natural smile. You don't want to have any indication that they've had an implant placed or that they've had any restoration.
So they can look natural? A dental implant in the front or whatever?
That's the goal, and that's, I think, very achievable. In many ways, we can get a much better result than we could do with some of the other types of treatment that we've done traditionally over the years.
Now, Harborview Medical Center, you set up or designed the oral maxillofacial, am I saying it right?
Yeah, when I first, in my early years in dentistry, I taught at the university for several years, and one of my duties...
What university did you teach?
University of Washington.
Okay.
And one of my duties was to go over and set up a dental clinic at Harborview Medical Center. They didn't have one up to that time. Now, in those days, we didn't do implants, and we didn't have that available. And a lot of the people that I saw there were people who were at the end of the road. If I didn't treat them, they weren't going to get treatment.
Okay.
And in those days, I listened to people who had had dentures for a long time, some people that just had dentures or they're getting their teeth taken out. And I listened to all the stories of people that were having problems.
Now, one of the things you mentioned, when we had our discussion, is that these denture wearers, even though they've been in dentures for 30 years, can still qualify for dental implants to give them something
absolutely.
fixed in their mouth.
Yeah.
Is that right?
Yeah, for many, many people that have lost their teeth many years ago and their jaws have gotten fairly small, many of those people can still have implants.
Has that changed? Was that not always the case?
Well, back, as I described to you, back in the 70s and 80s when I was there, and I listened to these stories of people having all these problems, we didn't have a lot of great ways to treat them. The only thing we could do was try and make a really good fitting denture, and for those people, many of them, even if it was a really good fitting denture, they still had the difficulties.
But what's new with dental implants? Has much changed there? Once they came along, are they much better now than they were in the old days?
Oh, well, the field is, as I said, is growing. It's just exploding as far as the interest in it, and there's a lot of changes that have occurred over time. When we had implants initially, and we could put implants in and fasten a denture to those, for those people it made a huge difference in their lives. And as the time has gone on, we've got better implant surfaces. Implants are very predictable today. We're in the high 90 percentile. Predictability of implants that are placed are going to succeed for a number of years.
So they don't fall out?
No, they don't fall out. In any treatment that you do for somebody, there's always a potential, but in general, no.
It's
they're
rare?
very, one of the more predictable things that we do.
So who is the typical dental implant patient that you see?
There is no typical patient. They cover a wide range, and that would start out with a person maybe losing one tooth or lost one tooth. There's people that may have lost 2 or 3 teeth. Maybe they've lost the teeth in the lower back and the lower left side, for example. They may have lost several teeth up above and front, and they may want replacement of some kind of prosthetics. Then there's people who have maybe lost their teeth 5 or 10 years ago, or maybe just lost their teeth. We'd have a little different treatment for the way we manage it, but basically they end up.
So the
with
word
same
is out,
result.
though. I mean, because of the internet, things like that, that dental implants can help these denture wearers.
Dental implants have changed the way we treatment plan. Today, I treatment plan any case totally different if there's severe problems where a person may be losing a tooth, or they've got gum disease and they're worried about losing their tooth a few years down the road. Many times we'll take out teeth much earlier than we ever would have dreamed of, so that we can put implants in while they still have plenty of bone.
So they get their teeth back.
So they get their teeth
for the
back,
most part.
For the most
so
part.
it's made of titanium post, goes in there.
Yeah, it's a little titanium. It looks like similar to a tooth, if you will, and that little titanium root form cylinder is put into the jawbone, just like your natural tooth root was. Okay, and then the tissue, then the bone heals around it, and then we can build it back up and restore it, put a cap or a crown on top of it.
But it sounds very painful, the procedure. I mean, do they complain about pain?
Well, that's a real common question. Everybody wants to know about that. And the answer to that is that for all the different types of treatment that we do, in general, this tends to be some of the easier types of procedures that we do. As an example, I do have patients that have had implants placed that have said, I took a few aspirin and that was it. Now that's not everybody. I don't mean to imply that you don't need any pain medication at all. And there's a cross section, just like there is in any patient population, but in general tends to be much easier than some of the other types of surgical procedures.
So you can put them out or sedate them completely?
Well, that's another issue. People say, just the idea of what you're doing, I don't care if it doesn't hurt. I just don't want to know what's going on. I don't want to be really all out aware. And so what we do for those people is we sedate them, and so that makes it very easy for them.
Is it true in some cases they don't even remember the procedure?
Oh yeah. There's many patients that have been sedated, have amnesia afterwards. They don't remember anything that happened during the procedure, which is wonderful for them. So it goes by very quickly, and it's very easy for them to have the treatment done.
So the people missing 4 or 5 teeth, I mean, perfect for them?
Implants are fabulous for them. For example, they could have 2 implants. And if they're missing 4 teeth in a row, you could put an implant on either end. This is one way of treating it.
Is it a cleaner way to go, too? I mean, is it a healthier way to go?
Well, it's healthier.
In your opinion?
I think it's definitely healthier in that if you can place an implant, if there's enough bone in the area to place an implant in that area, then you preserve the bone where the implants are placed, and the implants then will be strong for the rest of for as long as they last, which hopefully will be for many, many years.
So bridges and partials, though, I mean, are they? I mean, they definitely over time, depending on your age, wear out? Is that true?
I'd say
they get a little bit loose.
It's a hostile environment in there, and any dentistry that we do is at risk for having some problems down the road. If you have natural teeth that have had a lot of fillings and crowns, those are at risk for breaking or cracking, and they're also at risk for getting new decay. When you put in an implant, those teeth will never get decay, and they're very strong.
So they can last as long as you live, for the most part.
Yeah, they can. Today, I wouldn't say they're going to last you 100 years, but we know that they're very, very predictable. They're very strong, and they tend to be lasting for many, many years.
Okay, the denture wearers, you say they benefit the most.
Okay, well,
how so? And what are their options?
Well, denture wear, when I say they benefit the most, those people are the ones who have lost the most. Okay, and like I mentioned at Harborview, I saw a lot of people that had a lot of terrible stories of how they couldn't go out in public, they become recluses, they stay at home. Many of those people also have functional problems. They can't eat. At least they can't eat with their dentures.
They can't chew very well.
No, they can't chew. And so from a functional standpoint, they're eating soft foods and their quality of life is diminished. When you give those people back the ability to have rigidly placed teeth in their mouth again, now they can start to chew foods that they haven't enjoyed for years.
You said if there was a try-in period for denture wearers where you could give them some implants to secure something, they couldn't go back. I mean,
I don't think anybody that's like giving you sight for a few days and then taking it away again. I mean, that's probably an extreme example, but the point is, when you haven't been able to chew and you had difficulty functioning, and then you get that back, nobody's going to want to give that up if they don't have to.
Is this the happiest, you know, in dentistry, the happiest group of patients?
Oh, I'd say these are very, very happy group of patients. We have other happy patients that get some cosmetic treatment done with veneers and different treatment to improve their smiles. But I'd say these people are definitely truly happy, or they're grateful because it's giving them something that they had lost.
What are the age ranges of the denture wearers that you see?
Well, they can range all over the place. People can lose their teeth in their teens and 20s, all the way up to, you have denture wearers that are up in their 80s, 90s, and probably over 100.
That are getting dental implants, though?
Well, for getting dental implants, I'd say yes. People in their 80s are getting dental implants. Now,